Hi, my name is Katherine McVedge, and I am a social work major with a child life specialist minor. My topic is medical assisted suicide. I chose this topic because it is very controversial in today's society. Medical assisted suicide is used when a person is so sick that they intentionally want to end their own life. To be known as medical assisted, this must be done with the assistance of a licensed professional. This is done when a lethal substance is intentionally injected into the patient to end their suffering. To make sure patients are in the right mindset to make this decision, doctors will use the SAD person scale. Doctors will look at if the sex of the patient is male. They will look at if they are younger than 19 or older than 45 years of age. They will see if the patient has depression and if it is severe enough to be clinically significant. They will see if there were any previous suicide attempts or if they received any mental health services. Excessive alcohol or drug use is another thing to look at. If the person is thinking too rationally, the doctor will look into that as well. Another factor of the scale is if the patient is separated, divorced, widowed, or getting out of a serious relationship. If the patient has an organized suicide plan or any attempts, they would be on the scale. Finally, if they have no or little social support and have a sickness or chronic illness, that they are also on the scale. Medical assisted suicide is only legal in a few states. These states are California, District of Columbia, Hawaii, Oregon, Vermont, and Washington. Medical assisted suicide became popular and more controversial when Dr. Kevorkian, also known as Dr. Death, assisted in suicides. He was fascinated in death early in his pathologist career. In 1986, he found out that doctors in the Netherlands were killing people on death row using lethal injections. He decided to do this for patients in America and made a suicide machine that had 3 bottles that delivered a saline solution, a painkiller, then a fatal dose of potassium chloride. In 1990, the most famous suicide he assisted in was with a Michigan woman with Alzheimer's. She was put into the suicide machine and he was charged with the woman's death. After he was charged with the death, his medical license was suspended, but he still continued to assist with suicides. He claims to have assisted in 130 suicides. In October 1997, Oregon became the first state to legalize medical assisted suicide. Before a doctor assists in a suicide, they must observe the patients and make sure they do not have any psychological problems, for example, using the SAD person scale. Doctors must advise the patient to talk to their family about their decision and what choices they have to make. It must be said that it is okay for a patient to change their mind and not want to go through with a lethal injection. Doctors must get a second physician to look over the case and sign off on it after it is okay. 2 days after the written request is given, doctors can prescribe lethal drugs. The patients must take the lethal drugs themselves. This most often occurs in a patient's home with at least one healthcare worker there. Almost always, insurance does not cover the cost of lethal drugs. The pills these patients take are called Seconal, and they come in 100 caplets, and they must be broken apart. These pills produce 3 tablespoons of powder, and they can be mixed with water, applesauce, or pudding to hide the taste. Altogether, these pills cost about $125. Nemtabul is a liquid that costs more than $1,000 per dose. Some pros of medical assisted suicide is that people get to decide if they want to let their illness kill them or do it themselves. This gives people the right to end their life. When people are sick, they feel like a burden to their family because of medical costs, time in the hospital, and many other things. Lastly, people who have been sick for a long time no longer have the strength to fight anymore. Some cons of medical assisted suicide are that a doctor's job is to help patients, not help them end their lives. Doctors are told to do everything to help their patients, and when their patients want to end their lives, doctors feel like their job was not completed. It is possible that doctors can make mistakes and give a wrong diagnosis, giving patients wrong information. Finally, a lot of doctors are against helping people to die and refuse to help them. My view on the issue is that I believe that medical assisted suicide should be legal. It should be legal because some people will never truly know what a sick person is going through or feels like. If they truly do not want to live anymore, then tests should be done to make sure they are not depressed and do not have any other mental health issues. Ultimately, it is the patient's decision to keep fighting their fight. With the help from their families and medical advice from their doctors, the patients will make the decision that is best for them.